Hello, so good morning, everybody. My name is Aurélie Barth, and I work in the European Pharmacopoeia department as a scientific program manager. And in fact, I work with a group of experts which elaborate monographs or also take care of the revision of the monographs. So today we will speak about the impurity control in the European Pharmacopoeia. So first of all, I will explain you a little bit what will be discussed today. So first, we will see which impurities are controlled in the European Pharmacopoeia. Then I will also give you some information on the general text and the general monographs, which refer to the control of impurities. Then the main part of the presentation will focus on the control of organic impurities. So we will see the general text which refer to this kind of impurity. Also, how we identify the impurities, which system suitability test has to be fulfilled, and also some information on the response and the correction factors. Then I will also explain you how we set the specification in the individual monographs. A few words also on the validation and the implementation of the pharmacopoeia procedure. And then I will give you details on the other kind of impurities, such as the residual solvents, the water, inorganics, elemental impurities, and also genotoxic impurities. So first of all, I just wanted to highlight the different kind of impurities which are controlled in the European Pharmacopoeia. So the vast majority of the impurity control are organic impurity. And then we also control in all individual monograph the water content, the residual solvents. We also control inorganics and elemental impurities, so which are subject to ICH Q3D. And then we also control genotoxic impurities because there are more and more genotoxic impurities which are now covered in individual monograph. And I will also give you some information on how we deal with nitrosamines. So first of all, I will explain you which general monographs and text you have to look at to control the impurities. So something important to note is that before you want to analyze a substance, so you have to look, of course, at the individual monograph, which covers the substance, but you will also have to look at the general monographs. If you go to the online version of the European Pharmacopoeia, you can see here that there is a link to the list of all general monographs. And then you have to search which general monograph should be applied to your product. And something also important is that when a general monograph does not apply to a particular substance or product, then it will be stated in the individual monograph. But if nothing is written, you have to look at both. So you have really to fulfill the requirements of both the general monographs and in the individual monograph. Something also important is that a general monograph describes the requirements that have to be fulfilled, not only for the substances and the preparation which are covered by an individual monograph, but also for all the substances and preparation which are in the scope of the definition sections. So it means that even if there is no individual monograph in the pharmacopoeia, you have to fulfill the requirements of the general monographs. And you will also see here that in the online version of the pharmacopoeia, so you have a link to the general notices. So I also invite you to look at this text because it's really useful. It's really helpful to have some general understanding on the European Pharmacopoeia. So the general text or monograph that covers the control of impurities. So there is first the general monograph 2034 on substances for pharmaceutical use. So this monograph describes the general requirements for the control of residual solvents, organic, elemental, and also genotoxic impurities. Then there is another important text, which is the General Text 510 on the control of impurities in substances for pharmaceutical use. And this is a general text which is really helpful to interpret the test for the related substances. It also provides some definition and explanation on how you have to interpret the related substances test. So mainly when we discuss about old monographs. Then there is the general monograph 2619, which is the monograph on the pharmaceutical preparations. So this text describes the general requirements for the control of degradation products, residual solvents, and elemental impurities. Then we have a general text 5.4 on the residual solvents, which is more or less a reproduction of ICH Q3C. And then for the elemental impurities, we have the general text 520, which is not a reproduction of ICH Q3D, but it's more, but in fact, it describes the general concept of these ICH guidelines, and it also makes it legally binding. So we will start now with some information on the organic impurities. So it is it is really the most controlled impurities in the European Pharmacopoeia. So if you look at an individual monograph, you will see that the big part of the monograph concerns the control of organic impurities. So there are several techniques which are used to control organic impurities. Most of the time, you will see that we use an LC method. It can be with different detection modes, but most of the time we use UV detection. In some more recent monograph, there is also a UPLC method, which are described. And then you will also find some TLC. So the TLC, you can find some TLC in some old monographs, or sometime in some recent monograph, you can also find some TLC, for example, to control one specific impurity. And there are more and more UPTLC also, mainly in the field of herbals, because it's really a technique that is quite powerful for this kind of products. Then for volatile impurities, there are GC methods also, which are described, also with different detection techniques. And then this is more rare, so you can find some UV or chemical reactions also. So here on the screen, you can see an example of a classical LPI monograph. So it is a monograph on raltegravir potassium, which was recently elaborated. So first of all, you can see at the beginning of the test that you have a reference to the general chapters. So here it is an LC method which is used. So you have a reference to the general chapter 2229. And if you go through this text, you will see that there is also reference in this general chapter to the general chapter 2246 on the chromatographic technique. So it is important also to look at this text before you start the testing of your substance. Then there is the list of all reference solutions that should be prepared to analyze your substance. Here you have the system suitability test. Then there is the part for the acceptance criteria. And at the end of the monograph, you will find the transparency list. So you will see the list of all impurities that are now to be controlled by one or the several methods which are described in the monograph. So to control organic impurity, we rely on ICH Q3A. So in fact, in the general monograph on substances for pharmaceutical use, you can see that there is this statement: unless otherwise prescribed, organic impurities in active substances are to be reported, identified whenever possible, and qualified as indicated in the table which is on the slide. And in fact, this table comes from ICH Q3A. So in fact, we follow ICH Q3A for the control of the impurities. Then I already mentioned it. There is a general text on the control of impurities in substances for pharmaceutical use, which is also quite important because it gives you some terminology also, and it is also helpful to interpret some of the related substances tests. And this is especially true in all the monograph where, for example, we don't have the same wording. We use the term any other impurity, other impurities, or any spots. But I will show you an example later. So as I say, in the general text 510, you can find some definition. So you will find the definition of specified impurities. So specified impurities is considered as an impurity that is individually listed and limited with a specific acceptance criterion in a monograph. And a specified impurity can be either identified or unidentified. So for example, here in Raltegravir monograph, you can see that impurities C, E, F, and G, they are specified impurities because they have a specific limit. For example, for impurity C, a limit of maximum 0.3%, and for the other one, maximum 0.15%. Then we have the other detectable impurities, which are defined as potential impurities with a defined structure that are known to be detected by the test in the monograph, but not known to be normally present above the identification threshold in the substance, in the substances used in a medicinal product. And they are unspecified impurity, so they are limited by a general acceptance criterion. And the unspecified impurities, they are defined as impurities that are limited by a general acceptance criterion and not individually listed with their own acceptance criteria. So for the unspecified impurity, you will see that here it is all the impurities which has listed here at the end. So it is impurities A, B, D, and H, and they are limited at maximum 0.10%, so which correspond to the limits given also in ICH. So here on the screen, you can see another example. So this is a monograph which is quite old and which is not in line with ICH. So when you look at the monograph, first you can have the impression that this monograph is in line with ICH, but in fact it is not. So if you go to the related substances test, you will see that there is a limit for any impurity. So for any impurity should be less than 2%. And then there is an additional requirement that not more than one of the impurity should be present at more than 1%. Then there is a limit for the total, which is set at maximum 2.5%. And there is a disregard limit at 0.05%. But there is no transparency list here. So for this kind of monograph, you also have to refer to the general text 510. And in this general text, you can see that there is a flowchart So you have to follow also this decision tree, sorry. So you have to follow this decision tree and reply to the different questions. So first, the first question is, does the related substances section of general monograph apply? So it applies because it's substances which is used for human use, and it's not a peptide, so the general monograph apply for this substance. Then the next question is the general acceptance criterion less than or equal to the applicable identification threshold? So as I explained, for this monograph, there is no limit for the unspecified impurity, which is prescribed. So the reply is no. The third question, does the monograph have an impurity section? So as I said, there is no impurity section. So again, the reply is no. And here you see that you have to apply, in this case, you have to apply the general monograph 2034. So we go back to this table, and as it is a substance which is used for human use, and the maximum daily dose is less than 2 grams. So in this case, you have to apply a reporting threshold of 0.05%. So this is already described in the monograph. But you have also to apply here limits. You apply the threshold for the identification. So you have to identify all impurities which are found above 0.10% in your substance. So this limit is not clearly described in the individual monograph, but you really have to rely also on the general monograph for this limit. Something also important that is stated in this general monograph is that there are sometimes specific thresholds also that might be applied for other impurities. Usually for impurities which are known to be unusually potent or to produce toxic or unexpected pharmacological effects. So it means that if, for example, you notice that one impurity is genotoxic, so in this case, you will have to introduce a specific limit for this impurity, and usually the limit will be stricter than the limit set via ICH guideline. Another important thing is that if an individual monograph does not provide a suitable control of a new impurity, so in this case, you as a manufacturer, you have to develop a suitable test to control this specific impurity. So this is something which is written also in the directive, and I also put on the slide here the extract of the general notices. So if, for example, you produce a substance with a different route of synthesis, and you obtain a different impurity profile, in this case, you first have to check if the method which is described in the monograph is suitable to control these new impurities. And if it's not the case, you have to develop a more appropriate method to control these impurities. And you have also to inform the National Pharmacopoeia Authority and the EDQM. And in this case, we will revise the monograph in order to have a monograph which covers all potential impurities. So now I would like to invite you to do a quiz. So I would like to know if you can reply to this quiz by telling me for you how you would identify an impurity in a chromatographic system. So on the screen, you can see the proposal. So it can be by retention time, by relative retention, using a reference standard or reagent, or by in situ degradation, or if you consider that there is no need to identify an impurity. So you can scan the QR code which is on the screen and reply to this question. So I will give you a few minutes. So I see that there are still some people who reply to the quiz. So I will wait a little bit. Okay, so if I go to your replies, so thank you for replying to this quiz. So you see that 79% reply that that's the most appropriate way to identify an impurity is by using a reference standard or a reagent. So this is correct. And it is the approach that we follow as much as possible in the European Pharmacopoeia. So of course, I see that nobody replied that there is no need to identify an impurity. So this is already good. Then for the by relative retention and by retention time, so there are about 50% of the people who reply for by retention time or by relative retention. So for the retention time, this should be avoided because depending on the chromatographic system or the instrument that you use or the column, there might be some differences. So it's not really suitable to really ensure the identification of an impurity if you use only the retention time. For the relative retentions, it is a little bit better than the retention time because it's more robust, I would say, but we also try to avoid this. So for us, we really follow the approach to use a reference standard or a reagent. Yeah. Then there is also another option, which is sometimes used, is to use the in situ degradation reaction. So this is also for us a good option to identify an impurity. So as I said, so in the European Pharmacopoeia monographs, we identify all impurities which are specified impurities and also all the impurities which are used for the system suitability test. So most of the time we use reference standards, so it is called CRS. And there are different kinds of CRS which are available. Sometimes it is a CRS of a specific impurity. So for example, here in reference solution C, you can see that there is a CRS to control, to identify impurity E. And then we have other type of CRS which are named for peak identification or for system suitability. And here, most of the time, it is a mixture of the API and of one of several impurities. We also describe reagents. So most of the time, it is when the impurity is easily available on the market. So instead of establishing a CRS, we describe a reagent. And as I say, a good option is also to describe an in situ degradation. So it is, for example, the case here for impurity C. So there is this preparation which can be used to identify impurity C. Sometimes also we provide a typical chromatogram, so with the CRS. So this chromatogram is available in the leaflet of the CRS and is also available on the EDQM website. So this is clearly indicated in the monograph when it is available. And we sometimes get the question is, so in fact, the retention times and the relative retention, which are given in the monograph, we consider that they are only given for information, so they are not mandatory. It is a reason why it is written as about, and it's not a strict retention time. So what is important when you check a monograph is even if you observe a shift in the retention time, so it's not necessarily a major problem, but you really have to verify that you comply with the system suitability test. Of course, if you observe a very big difference, it might be possible that you have a problem with the method. So regarding the system suitability test, so it is really important that you follow the system suitability test which are described in the individual monograph. So most of the time there is a resolution or a peak-to-valley ratio which is described in the individual monograph. But it is also important to comply with the system suitability tests which are described in the journal chapter 2246, so on chromatography techniques. And here for the control of related substances, there are two things that you have to look at. First, it is a symmetry factor. So it is a symmetry factor of the peak of the solution which is used for quantitation. And this factor should be between 0.8 and 1.8. And then you also have to ensure that your method is sensitive. So you have to verify the minimum signal to noise ratio at the reporting threshold. And the signal to noise ratio at this level should be at least 10. So this chapter was revised recently, and so it is published. The new version is published since the 11th edition, and it has been harmonized also within PDG. So as I say, in the individual monograph, so most of the time you can see that we prescribe a resolution or peak-to-valley ratio. So it's really to check the selectivity of the method. So we try to define the critical pair in this chromatographic system. So when the two peaks are well separated, so we prescribe a resolution. So usually the value is below 5 because we consider that if there is a resolution of more than 5, the two peaks are very well separated. So we try to look for another critical pair. But when the substances are really pure and there is no other critical pair, sometimes we can have a resolution which is above 5. On the other hand, we never set resolution requirements which are less than 1.5 because we consider that if the resolution is less than 1.5, the two peaks are not fully separated. And in this case, we will switch to a peak-to-valley ratio. So again, for the peak-to-valley ratio, we also try to avoid to prescribe a peak-to-valley ratio which is less than 1.5. And we sometimes also get the question, so what should I do if, for example, in a monograph, there is a peak-to-valley ratio which is described and I obtain a baseline separation, so the two peaks are are separated. So in this case, you can consider that you fulfill the requirements because the separation is even better than the separation which is prescribed in the monograph. So it is not a problem, even though you cannot calculate the peak-to-valley ratio. For the calculation of the percentage content of the impurity, so there are several options which are used in the European Pharmacopoeia monographs. So most of the time we use the dilution of the test solution. We can also use an external standard or the impurity itself. So these are the preferred option in the monograph. When we use the dilution of the test solution, it is really important that before, so during the development of the method, that we check the response factor of the impurities because this can have a big impact also on the limits. And then there is another option is to use the peak area normalization, but we in general try to avoid this technique, especially when there are differences in the responses. So here I put an extract of Raltegravir monograph. And for this monograph, so we control the impurities using reference solution B, which is a dilution of the test solution. And most of the time, we use a solution with a concentration which correspond to the concentration of the limit for the unspecified impurity. So in this case, 0.10%. So I will explain you why it is important to check the response factor. So here you can see a chromatogram of a solution which contains ascorbic acid and its impurity, so impurity C. So if you look at the area of the two peaks, you can see that there is a similar peak area, but in the solution which has been injected contains impurity C at a concentration 8 times higher than ascorbic acid. So you can see that if we don't correct this by a correction factor, it will have a big impact on the value that we obtain for the content of this impurity. So to set the response and the correction factors, so in the monograph, we consider that the response factor which are found between 0.8 and 1.2, they are negligible, so we will not indicate them in the monograph. So we only indicate the correction factor is they are outside this range. And when we find a correction factor which is higher than 5, in this case, we will quantify the specific limits, usually with an external standard. We will not use the API to quantify this impurity. So it is also the reason why for us it is really important that we get also sample of all impurities during the development of the method so that we can really check the response factor of each impurity. So you can find more details also on how we calculate the correction factors in the technical guide. So the technical guide is available on the EDQM website, and there is also the link here on the slide. So usually we compare the response of the reference peak and the impurity peak by using the mean of the area ratio over the whole range of linearity, or the ratio of the slopes of the respective linearity regression equations. Here you can see on the screen also the formula. So for example, you can also inject a solution which contain the substance to be tested and the impurity at more or less the same concentration, and you compare the area of the two peaks, and of course you have to correct the area by the correction of the test solution and of the impurity. And there are sometimes some confusion also, so I prefer repeat this. Usually we calculate the response factor, which is the sensitivity of a detector for a given substance relative to a standard substance. And then in the monograph, we indicate the correction factors, which are the reciprocal value of the response factor. So when we check the response factor, it is also important to consider the purity of the impurity and of the test substance, because this can have an impact. So for the purity, We have to take into account the water content, also the solvents which can be present, and also the potential impurities which can be present in the sample. And something also important is to check the form of the impurity and of the test substance, because this can have an impact also, especially when it is a big salt. For example, if it's we have a monograph on sorafenib So here, if we don't consider the salt of the impurity and of the substance, we can end up with a big difference in the responses also. And of course, when we determine the correction factors, it is important to carry out the method at the wavelengths and also at the flow rate, which is defined in the monograph. Then a few words about the reporting threshold. So in the current monograph, we use the term reporting threshold, which is defined in ICH Q3A as the limit above which an impurity should be reported. So in the past, we used the term disregard limit. So you can still find in some monographs the term disregard limit, but it is exactly the same meaning. In the monographs, this reporting threshold serves as two purposes. So the first one is a decision criterion for the user to know whether a peak should be considered for the calculation of the total of impurity. So for example, in raltegravir, you have a reporting threshold of 0.05%. So it means that all impurities which are found below 0.05% are not taken into account for the calculation of the total. And then the second purpose is to check the sensitivity of the method. So as I already explained, so according to the general chapter 2246, you have to ensure that you obtain a signal to noise ratio of minimum 10 at the reporting threshold. So this is the classical signal to noise ratio that you have to verify. And in some monograph, we add an additional sensitivity test. For example, when we know that there is one impurity which have low response. So when the response factor is found below 0.8. So for example, if we notice that there is an impurity which has a response factor of 0.5, and that during the validation of the methods, we notice that the sensitivity is a little bit borderline. So in this case, we will include an additional criteria. So there are two options. The first one is to use again the dilution of the test solution, but instead of having a signal to noise ratio of minimum 10 as the reporting threshold, we will prescribe a signal to noise ratio of minimum 20. So 20 because we take the classical value of the signal to noise ratio of 10 and we multiplied by 2, which correspond to the correction factor. The other option is to use a solution which contains the corresponding impurity, and we ask to obtain a signal to noise ratio of minimum 10 at the reporting threshold. So next, a few words on the medicinal product monographs. So you certainly know that for several years now, we elaborate also a monograph on medicinal products. So here we follow also ICH guidelines. And according to ICH guidelines, in fact, we control only degradation products. So it means that all degradation products that are controlled, so usually it's also via an LC method, and the degradation products, they are defined as all impurities which arise during the manufacturing process and throughout shelf life, and it also includes the impurity of synthesis that are also degradation products. And as for the API monograph, so they can be limited with a specific limit. So they will be listed as specified impurities, or they will be limited by the general acceptance criterion. So there will be a limit for the unspecified impurities. So it's more or less the same rule which is followed. For the impurity of synthesis, so they are not controlled. And if we know that they can be detected by the LC procedure, we will include them in the transparency list. But if we know that they can be present at a level higher than the reporting threshold, they will be identified, and after that, they will be disregarded. So it means that they will not be taken into account for the calculation of the total. So I will give you an example. For the threshold, so again, we follow ICH Q3B. And if you compare the two thresholds, you can see that there are some differences. So most of the time, the reporting, the identifications, and the qualification thresholds are higher than for the API. So I put this example here, so maybe it will be easier to understand. So for example, for ticagrelor, so there is the monograph of the API and also the monograph of the tablets. So according to ICH, in the API monograph, there is a limit for the unspecified impurity, which is set at 0.10%, and there is a reporting threshold set at 0.05%. And here in this monograph for the total, the limit is set at 1%. And in addition to this, you can see that there are 4 impurities which are listed as specified impurities with a limit from 0.3 to 0.1%. For ticagrelor tablets, the reporting threshold and the identification threshold are different. So the limit for the unspecified impurity is set at maximum 0.2%, and the reporting is set at 0.1%. And you can also see that for the total, there is a maximum of 0.5. So the total is lower than the total prescribed in the API monograph. So we sometimes get the question, why there is this difference in the total? But in fact, you can see that for the determination of the total for the tablets, you only take into account the impurities which are present above 0.1%. And also, you have to disregard impurities A, B, and D because they are impurities of synthesis. So it is the reason why at the end we end up with a lower limit for the total. So I will also explain you how we elaborate our monographs. So how we set the specification. So there are two main procedures, the procedure 1 and the procedure 4. So the P1 procedure, it's for multi-source products. So when there are several manufacturers on the market, we will contact the manufacturers, and we will compile all the data, so all specification, all methods, all batch also, and stability data. And we will develop a monograph and especially an LC method, which allows the identification of all potential impurities. If when the monograph is is available, we notice that we need to add some additional impurities. In this case, we will revise the monograph. And then there is a P4 procedure. So this procedure is used only for single source products. So for the products which are still under patent. And here we really base our monograph based on the specification of the innovator. So we elaborate the monograph in close collaboration with the innovator. And then if we noticed after the publication that the monograph is not suitable for other products, other substances, we will again revise the monograph. For the limits, so we set the limits based on the limits as approved by the competent authority. And we also look at the batch and stability data. So the policy is that we always rely on the approved limit, and we don't set a limit higher than the approved one. But then we also look at the batch data. So I will give you an example. So for example, if we receive a request to introduce a new impurity, which with an approved limit of 0.2%, we will look at the batch data. So here I put an example of batch data that we can obtain. And we will use the mean value plus 3 sigma approach. So we will calculate the mean value plus 3 sigma. And based on this value, so here we obtain 0.09%, we will set the limits. So as this value is below 0.10, we will propose in the monograph to set a limit of 0.10% for this specific impurity. And this will also have an advantage because in this case, we don't need to establish a CRS to identify this impurity. So our monographs, so in our monograph, the procedure which are described, they are validated. So they are validated according to ICH Q2. And so it's not necessary for a manufacturer to do a full revalidation of the monograph, but it is important before you use the method to implement the procedure. So this is written in the general notices that you have that the user must access whether and to what extent the method is suitable under the actual condition of use in the implementing laboratory. And to help the user, we have elaborated a new chapter. It is chapter 526 on implementation of pharmacopoeial procedure. So this chapter is only for information, and you can find also here there is a link to some examples. So these examples, they are available in the knowledge database. So this chapter, as I say, it's for information only. So it's describe one approach that can be followed, but we know that there are other approaches that may be appropriate also. So it is really the responsibility of the user to define the most appropriate approach for the procedure that they want to use. And the aim, so it's really to give some guidance on the approach for implementation. So if you look at this text, you will see that as a first step of the implementation process, you have to do an assessment. So prior to the first use of the procedure in your laboratory. And the purpose of this assessment is not to evaluate the intrinsic capability of the method, but really to determine whether there are any factors associated with the complexity of the procedure and the actual condition of use to implement this method in your laboratory. So for example, a critical factor can be determined depending on the composition of the substance to be tested, on the complexity of the sample preparation, or depending on the reagent also that are used, or depending on the equipment or the environment of the use for this procedure. So if there is no critical factors, so you can use the procedure without any specific verification experiments. But if there are some critical factors, then you will have to do some lab work. So the second step is to evaluate the analytical procedure performance characteristics, so APPC. So for example, the accuracy and the precision that are considered to be relevant. And here you can see that there is a table. So depending on the type of test also. So if the test is, for example, an assay or for an identification test, you will have different parameters to, you will have to analyze different parameters. So now I will give you a few information on how we determine the water content and the residual solvents. So for the water, there is in almost all LPI monographs a test to control the water content. So there are different techniques which can be used. There is first the semi-macro determination. There is also the micro determination. So there are also different techniques which are used. And there is a loss on drying. And in the medicinal product monograph, usually there is no test because we consider that the water content is product specific. For the residual solvents, so they are controlled according to the general text on residual solvents, which, as I say, is a reproduction of ICH Q3C, and also according to the general chapter 2424 for the identification and control of residual solvents. And as I explained, so there is a reference to this text in the general monograph on substances for pharmaceutical use and on pharmaceutical preparation. So in fact, ICH Q3C becomes legally binding through these references. So in the API monographs, we follow the following approach. So for the class 1 solvents, there is always a test and a limit for such a test, for such solvents. For the class 3 solvents, usually they are not included because they are limited by the option 2 of the general chapter. And for the class 3 solvents, they are only named and limited when they have a limit which is above 0.5%. And the class 3 solvents, mainly for the volatile solvents, they can also be controlled by the loss on drying test. Then for the inorganics and the elemental impurities, so there are also several texts which explain how we control this type of impurities. So first, you can find in the European Pharmacopoeia several general methods which explain how to control this type of impurities. So for example, there is a test for the sulfated ash. Also, there are some specific tests like ICP, MS, and there is also the general chapter 2420. Then there is the general text 520, which is an implementation of ICH Q3D on elemental impurities. And there is, as I said, the text 2420 for the determination of elemental impurities. And something important to note is that this text has been recently revised, and now it is harmonized within PDG. So the revised version of this text will be published in January next year. For the general monograph on substances for pharmaceutical use, there is also reference to the control of elemental impurities, and also in the general monograph on pharmaceutical preparations. And with this reference, again, ICH Q3D becomes legally binding. So here it is an extract of the general monograph on pharmaceutical preparations. So you can see that it is written that the general text on elemental impurity applies to pharmaceutical preparation, except for the products for veterinary use and for unlicensed preparations. So via this sentence, it means that ICH Q3D is legally binding. So what was done in the individual monograph is that for the 9th edition of the Pharmacopoeia, we deleted all the classical heavy metal tests, so which were defined in the general monograph 248. And this was done for all individual monographs which are used for human and veterinary use. Then there is the second part of this paragraph, which explains that for pharmaceutical preparations, so which are outside the scope of the general chapter 520, the manufacturers, they are responsible for the control of the elemental impurities using the principle of risk management. And with this part of this paragraph, it was decided also to delete all the classical heavy metal tests, also from the monograph which covers the substances for veterinary use only. And this was done for the 11th edition. Apart from this classical test, there are also sometimes specific elemental impurity tests. So for this kind of test, it was decided not to systematically delete them from the monograph. And it was proposed to suppress the test when the elements have been intentionally added to the substance. For example, if it's a reagent or a catalyst which is used during the synthesis. But we decided to keep such a test when the elements are of natural abundance and they cannot be eliminated, for example, by purification. So here you can see an example of the monograph on calcium phosphate. So before there was already a test to control arsenic, and now there is a test to control arsenic and lead. So there is a test and there is a maximum limit content. So here it is 2 and 1 ppm. But there is no method which is described in the monograph, and in fact it is the responsibility of the manufacturer to develop a suitable method to control these two elements. It was also agreed to maintain the test in the monograph when it is important to ensure the quality. And there are also some other cases, special cases, for example, for the monograph on methylene blue. So here we know that the elements may have an effect on the therapeutic activity, so it is proposed to keep it. So now I go to the last type of impurities which are controlled in the European Pharmacopoeia. So it concerns the genotoxic impurities. So for the genotoxic impurities, we also follow ICH, but here we follow ICH M7. So there is also reference to ICH M7, which is included in the journal monograph on pharmaceutical on substances for pharmaceutical use. And we usually include a test in the individual monograph when we have the proof that an impurity is genotoxic. So for example, if we have some toxicological studies or the result of the AIM test. We usually we don't include a test if it's only a structural alerts. And also something which is important to know is that we at the EDQM, so we don't assess the toxicological data. So we only rely on the assessment done by the competent authority. So for example, if there is a limit, we will put in the monograph the limits as it is approved by a competent authority. Then there are different options. So either there is a test in the test section. So for example, when we know that there is a suitable procedure to control this impurity, and that there is also a limit which is a no and approved by a competent authority. Or we can put also something in the production session. And it can be the case, for example, when this impurity is controlled by a specific technique, which is not so widely used, or if there is no specific test or specific limit, which is known. For the nitrosamines, so it is a specific case of genotoxic impurities. So we work on this type of impurities for several years now, and so we have revised several texts to follow the different recommendations. So we recently revised the general monograph on substances for pharmaceutical use and on pharmaceutical preparation. So in fact, we introduce a new paragraph in the production, under production, which explains the FER approach. So here you can see on the slide the extract of these two texts. And in fact, we say that the manufacturers of the substances for human use, they are expected to evaluate the potential risk of nitrosamines formation and contamination, which occur during the manufacturing process and during storage. And if there is a risk, they have to mitigate as much as possible the presence of nitrosamines and do a control strategy, and a control strategy should be implemented to detect and control this kind of impurities. In these two general monographs, there is also a reference to the general chapter on nitrosamines, which give you some, which provide you some methods to control this type of impurities. So this general text was elaborated already some years ago. So first, this general text allows the detection of 7 nitrosamines in the Zartan active substances. And at the same time, there were also 7 reference standards which become available. So this text was adopted in November 2020. And as it was really seen important, it was decided to publish this text just after the adoption on the EDQM website. And now it is available since the supplement 10.6. So at the beginning, this text covers only the control of nitrosamine in active substances. And now we have extended the scope of this chapter. So we also changed, you can see the title of this chapter, of this text. And now there are some procedure to control nitrosamine in the active substances, but also in the medicinal products. So in fact, there are two procedures, A and C, which allow the control of nitrosamine in medicinal products. And this is also something which is new, is that these two procedures can be applied as a quantitative test. So this revised text was only adopted in November, so last month, and will be published next year in July. So how we tackle now the risk of the presence of nitrosamine in individual monograph. So you have maybe noticed that we have revised the Zartor monograph several times this last years. And so now for the Zartor monograph, it was decided to delete the production session. So in fact, for this monographs, there is no mention of the nitrosamines in the individual monograph, because we consider that the control of nitrosamines is covered by the general monograph on substances for pharmaceutical use and pharmaceutical preparation. So the policy is that we will not introduce any production session nor a test in the test section. But there are also some options that can be considered. So for example, we can also decide to introduce or to keep a test in the test section, but in this case, it will be only if the presence of nitrosamines is really confirmed and is risk originates from the API manufacturing or from stability. There is also another option. We receive also the information that some manufacturers, they use antioxidants, so to limit the presence of the formation of nitrosamines. And in this case, we will not include a specific test, but we will include a statement. A suitable antioxidant may be used, so this information will be added in the definition section. So to conclude, so there are several texts which mention the control of impurities in the European Pharmacopoeia. And the approach that we follow is in line with the different ICH guidelines. We also follow the new regulation and the new recommendation. So for example, we update our text based on the new recommendation for the nitrosamines. We also update our monograph based on the new technology or the scientific advances. So we try to avoid the use of TLC, and we describe now more and more LC methods. So for almost all monographs. And as I explained, so our monograph, so they really reflect the quality of the substance or the product which are available on the European market. We base our limits based on the limit as approved by the competent authority. And of course, we also look at the batch and the stability data which are available. As I explained, so the monographs, they are developed by the group of experts, and all the procedures which are described in the monographs, they are validated and also verified by the experts. But there is also an implementation which is necessary if you want to use it in your laboratory. Of course, if you are interested to work with us to elaborate a new monograph, or if you consider that monograph need to be revised, for example, if it's still a monograph written in an old style, so don't hesitate to contact us. You can contact us directly, or you can contact the National Pharmacopoeia Authority. So there is a link which is available here on the slide. So for us, it's really important to get also your data to be in the position to keep our monograph up to date. The process to elaborate the monograph and also the revision process is transparent. So you certainly know that when we elaborate a new text, and also for all revision, we publish the draft in Pharmalopa. And these drafts, they are available for public consultation. So it is free to access to Pharmalopa. So don't hesitate to look at this proposal and to submit your comments if it's necessary. So thank you very much for your attention. And now we can reply to your questions.
Thank you, Aurélie. Good morning, good afternoon to all of you. My name is Bruno Spildana, so I will be joining also for this Q&A. Thank you all for having listened to Aurélie, and while Aurélie is taking a sip of water to prepare for the Q&A, so as said, I'm going to help out for the Q&A, and maybe I'm going to take the questions so that Aurélie has time to look at hers. Up front, we are sorry, probably there are really many questions, and we're going to deal with them as they appeared, and but it's probable that we're not going to be able to tackle all of these. So if you have remaining questions, don't hesitate also remaining questions that were not answered after this Q&A to send them through our help desk if you feel that they need to be addressed. Yeah, now we're going to take what we can. So the first question is, if a specified impurity listed in a European Pharmacopoeia monograph is not potential in our route of synthesis, whether it is required to specify this impurity in our specification. So I think I may refer to the general notices here where, yeah, such cases are actually described in a general way there. But there's always a certain form of assessment when you apply the monograph. And if there are impurities either listed as specified or even as unspecified, these other detectable impurities, that are not relevant to your specific route of synthesis, then you just actually have the rationale for not doing anything on those impurities. I mean, this needs to be included in your files for any review by either inspectors or during a request for a CP or any other regulatory process. But it's quite easy in this frame of the European Pharmacopoeia to actually justify that a particular impurity is not relevant for the route of synthesis that you are using. Aurélie, maybe if you want to take one question.
Yes, then. I will take one question. So in general, how much response factor value is acceptable to use for an impurity content calculation? So I explained that when the response is more than 5, or if it's less than 0.2, usually we decide not to quantify so this impurity against the API because the response is too different. And in this case, we will use a solution which contains the impurity in question to quantify this, this specific impurity. So for us, yes, it's usually above 5 or if it's less than 0.2.
Okay, maybe I take one then. Also, please, why the DNA genotoxic impurities are not considered as organic impurities? I think this is probably misunderstanding. It's just, okay, they are not, I mean, the genotoxic impurities are just considered as any other impurity. The exception just being that for these kind of impurities, it's highly likely that there will be a much lower limit than for any normal organic impurity that where ICHQ3A applies. So in that way, they are treated a bit in a different way, but it could well be that, especially if you have a test and a limit described in the monograph, that you will find these genotoxic or DNA reactive impurity listed in the transparency list. But for the only exception being that for these kind of impurities, we have also another means of making sure that they are limited is by introducing a sentence in the production section, which is a bit of a more general way to do it, because for certain kind of substances, it proves quite difficult to have a particular limit, or limits are very low, or from time to time you also have, depending on the route of synthesis, you may have or may not have a certain impurity, or it may be different. So it's a more flexible way to deal with those impurities rather than having to include a limit that may not be suitable for all.
Okay, so I will take another question. Is it mandatory to include the additional system suitability criterion as per journal monograph? The general monograph on substances for pharmaceutical use, even though those are not available in individual monograph. So yes, it's really important that you look at all texts. So I'm not sure if I completely understand the question, but because there are two things. First, you have to look at the individual monograph, and then you have also to look at the requirements of the general monograph on substances for pharmaceutical use. So this for sure you have to follow. And regarding the system suitability criteria, so I don't know if you speak about the system suitability test. So here it's not described in the general monograph, but it's more described on the general chapter. So for the general chapter on chromatography, which is 2246. So for example, for the control of impurity, I explained that usually for the system suitability test, there is a resolution requirement in the individual monograph. But then you will also have to look at the system suitability tests, which are described in the chapter 2246. And it will be the control of the sensitivity. So with the control of the signal to noise ratio, and also the control of the symmetry factor. And this is also true, for example, so not only for the related substances test, but also for the assay, where you have also some specific system suitability tests that have to be fulfilled. So for the assay, it will be the repeatability and the symmetry factor.
Yeah, another question is, how should I apply the impurity specification if the individual monograph does not specify a retention time for the component? So I think it depends how that specification actually is. So first of all, I hope that you all got from the presentation of Aurélie, and I refer here also to the small poll that was done in the Slido tool. That the preferred way for the European Pharmacopoeia to actually identify impurities is by providing reference CRSs, or reference substances. This holds true for specified impurities, but then again, if you have an unspecified impurity, usually, well, you don't have necessarily the need to identify them in the chromatograms, because anyway they are limited by the limit for unspecified impurity, and they should be there below these thresholds for unspecified impurities. As soon as they would be above, then they would be specified impurities, and then again you need to identify them and quantify them properly. Therefore, we actually just specify in the monograph, so we do provide the information in the monograph that you have actually to have available to identify the impurities that are important according to the specifications. Now, if you have additional impurities, or if, for example, one of our unspecified impurity is specified in your applications, first of all, then probably we might need to update the pharmacopoeia and you can let us know. But then you need to have also the means to identify your own specified impurities if the monograph does not actually cover them.
Okay, so the next question, could you please elaborate on the criteria considered to set the limit for the total impurities in an individual monograph, which is the maximum upper limit that is generally acceptable? So it is the same approach which is followed. So I explained that for a specific limit, so we always look at the limits approved by the competent authority, and we look also at the batch and stability data available. And so for the total, it is the same approach that is followed. So we look at all limits, the value of all limits approved by the competent authority, and we will never set a limit which is higher than the approved one. And we don't necessarily take the highest limit, but we will look at the batch and stability data. And which maximum limit is generally acceptable? So it really depends on the substance. For the chemical substances, we notice that now the substances are really pure. So sometimes we have a limit of maximum 0.5, 1%, which is quite strict. And so for other substances, for example, for the antibiotics, there are more impurities that can be present. So in this, for these monographs, usually the limit is higher. But then it really depends on the substances, and also, yes, as I say, it's always based on the batch data available.
Another question, maybe this one refers to heavy metals limits. Why are heavy metals limits deleted from individual monographs? And I think, well, the slides touched upon that, but the idea here was that, well, first of all, the former heavy metals test was unspecific, it wasn't so clear with that test what kind of elemental impurities were covered or were not covered. And so the idea was, anyway, at the time then when ICHQ 3D came into application, that you needed to go further into the contents of elemental potential contents, or the contents of elemental impurities in your products, and by running risk assessments and so on, so that the heavy metals test and the corresponding limits that was included in many monographs was not at all considering risk assessment. It was merely a limit that was put generally in all, and that more should be done there. And it's provided merely a kind of a safety net, but not a good one, as I explained, due to the limitations of the method. And therefore we took the step to delete all those tests from monograph. They were then replaced by a general statement in the general monograph to ensure the continuity of the requirements for elemental impurities in products and ingredients thereof, because you also need the knowledge from the contents of the ingredients to feed into the risk assessment of the final product that the user will then get.
Okay, so the next question, could you please explain the meaning of reporting threshold? So it was explained in one of my slides, but I can explain it again. So there are two meaning. So the reporting threshold, so first it is, so usually in the API monograph, we have a reporting threshold of 0.05%. So if the substance is, if the daily dose is maximum 2%, and in this case, when you look at the impurity which are available, so all impurity which are present at less than 0.05%, so below the reporting threshold, so you will not take them into account for the calculation of the total. So for the total, you will only sum up the impurities which are present above this above 0.05%. So this is the first objective of the reporting threshold. And then for the reporting threshold is also the limit at which you have to check the sensitivity of your method. So if there is a reporting threshold at 0.05%, you have to inject a solution at this concentration. And you have to ensure that you still have a signal to noise ratio of minimum 10 at this concentration. And if it's not the case, it means that your method is not sensitive enough and that you can miss some of the impurities.
Another question around clarification for peptides covered in General Monograph 2034. Are these covered, these peptides? I think for peptides, there are specific limits that are valid for this kind of products. There is some information in 2034 about that, but it's not the general. So it wasn't specifically included in Aurélie's slides, but there is more information indeed in 2034, as is the case, I think, in ICHQ3A.
So another question, or unidentified impurity can be considered as a specified impurity. Please elaborate with example. So when we elaborate a new monograph or when we revise the monograph, I explained that we always look at the batch data available. So if during the elaboration process we notice that one impurity is always below 0.10%, then in this case we will list this impurity as unspecified impurity. But if there is, for example, another manufacturer which has the same impurity but above the limit of 0.10%, there is a possibility for us to revise the monograph. But I always say that we don't set limits, so at the EDQM, so it's not the responsibility of the EDQM and the group of experts to set new limits. So in fact, this new limit should be first approved by a competent authority. So if you provide batch data to the competent authority and you justify this new limit, which will be above 0.10, and if this is approved by a competent authority, then we can also revise the monograph to increase the limits for a specific impurity. And if you want to know the process for the revision, you can go on the EDQM website and you can find all information.
Thank you, Aurélie. So maybe I'm going to take a last question. It's somehow also a follow-up to what Aurélie has just said, and something that comes quite often. If EDQM does not assess toxicological data, why does the policy document and content of the dossier state toxicological data should be provided in support of classification according to ICH M7? So maybe a disclaimer that we should do when we say, so Aurélie, myself, or I mean, that EDQM does not assess, I mean, what we have in mind is that especially in our field, which is the European Pharmacopoeia, so the group of experts that deal with the European Pharmacopoeia, that elaborate monograph, those do not assess toxicological data. Now, indeed, when you are referring, if what you have in mind is in the frame of a CEP, when you enter into discussion with EDQM on a CEP, there is some assessment of toxicological data. There is assessment on additional tests in apart from what is described in the monograph. And therefore, maybe we are wrong when we say that EDQM does not assess, but I mean, what we refer to is the European Pharmacopoeia. So just to be clear that in the process of elaborating a monograph, there is no additional toxicological assessment done. And I think this also holds true for the some of the questions I saw on whether ICHM7 applies, whether and how we do that, whether we include limits in particular when this substance may be used in a lot of different formulations that do have different levels of APIs. This is definitely something that is not necessarily taken in account during the elaboration of monograph again, but would be something that is indeed discussed by the certification part of EDQM, that indeed is, when it comes to certificates of suitability, is the competent authority in this case. So they would be assessing this data, and you will enter in toxicological discussions with them on what limits applies or does not apply. So just maybe to try to lift that misunderstanding in a way. And I think this will be the last question we have taken. We are already a bit over time. Sorry again that we couldn't tackle all your questions. We've done what we could in the time given. Again, if you feel that you still want some answers on the questions you provided us in the tool here, don't hesitate to copy it, repeat it in our help desk. We will be more than happy to try to answer them there. It's also the tool we use constantly for answering your questions, where you can also contact us if, as Aurélie mentioned, you have some justification of monographs that do need some revisions or new impurities, new levels that you would like to see in the monograph. This is the tool where you can contact us also. And well, thank you again all very, very much for staying around, for listening to this Q&A, to this webinar as a whole. The presentation file will be shared with you, and the modules will also be available afterwards for on-demand listening on our EDQM platform, EDQM websites. So you can also propagate these information or these modules if you find them useful to your colleagues, to your peers. So thank you all very, very much. Thank you, Aurélie, for leading us through your slides and for answering this Q&A, and see you around. Bye-bye.